Sexual activity, particularly when it involves intercourse, is a deeply personal and intimate act that involves both physical and emotional aspects. Below is a detailed, respectful explanation of how sex typically occurs between consenting adults, emphasizing important elements such as consent, preparation, and safety. Number 1. Consent and communication before engaging in any form of sexual activity. Clear, enthusiastic, and mutual consent is crucial. This means that both partners agree to engage in sex freely and without any pressure or coercion. Open communication is essential to ensure that each person feels comfortable, safe, and respected. Ask for consent. Make sure your partner is willing and excited about engaging in sexual activity. Consent should be ongoing, meaning both partners can check in with each other throughout the experience. Discuss boundaries. Talk about what you're both comfortable with and what you're not comfortable with. This may involve discussing sexual preferences, contraception, or anything else related to the encounter. Understand that consent can be withdrawn. Either partner has the right to stop at any time if they no longer feel comfortable. Number 2. Preparation. Sex can be physically and emotionally intense, so some preparation can help ensure a positive experience. Personal hygiene. It's a good idea for both partners to ensure they're clean and fresh before engaging in sexual activity. This includes washing the genital area to reduce the risk of infections and increase comfort. Foreplay. Foreplay is an important part of sex that involves kissing, touching, and other forms of intimate contact to increase arousal. Foreplay helps both partners become physically ready for intercourse. For women, foreplay can increase vaginal lubrication, which helps reduce discomfort during penetration. Use protection to prevent sexually transmitted infections, STIs, and unintended pregnancy. It's important to use appropriate contraception. Condoms are a common form of protection that helps prevent both pregnancy and STIs. Other methods of contraception include birth control pills, IUDs, and more, but these do not protect against STIs. Number 3. Physical act of intercourse. Once both partners are aroused and comfortable, the physical act of intercourse can begin. In heterosexual intercourse, this typically involves vaginal penetration, but there are other ways to engage in sex. Vaginal intercourse, penetration. 1. Positioning. The most common position for vaginal intercourse is with the male partner on top, missionary position, but there are many positions that can be comfortable and pleasurable for both partners. Both partners should find a position that works best for them. 2. Penetration. The male partner inserts his penis into the female partner's vagina. It's important to go slowly and gently, particularly if it's the first time for either partner or if either partner experiences discomfort. Vaginal lubrication helps make penetration more comfortable. 3. Thrusting. Once penetration is achieved, the male partner will typically begin a rhythmic movement, or thrusting, inside the vagina. Both partners should communicate during this process to ensure it's enjoyable for both. 4. Clitoral stimulation. For many women, direct stimulation of the clitoris, the small, sensitive organ located above the vaginal opening, is crucial for reaching orgasm. This can be done during intercourse, either by the male partner's hand, the female partner's own hand, or with the use of a toy. Oral sex on a male. Oral sex involves one partner using their mouth and tongue to stimulate the other partner's genitals. For a male, this typically means licking and sucking the penis, also called fellatio. On a female. For a female, oral sex involves stimulating the vulva, especially the clitoris, with the mouth and tongue, called cunnilingus. Many women find this highly pleasurable, and it can lead to orgasm. Anal sex. Anal sex involves the insertion of the penis into the partner's anus. This type of intercourse can be pleasurable for some people, but it requires a lot of preparation and care. Since the anus does not naturally produce lubrication, it's important to use plenty of water-based lubricant. Both partners should communicate openly to ensure comfort and avoid injury. Number 4. Aftercare after sexual activity. There are a few important things to consider. Emotional connection. Sex can be emotionally intimate, so spending time with your partner afterward can deepen your connection. This could involve cuddling, talking, or simply being close. Clean up. After sex, it's important to clean up to prevent infections. Both partners should wash their genital areas with water and mild soap. Urinating after sex is especially important for women to help prevent urinary tract infections, UTIs. Check for any discomfort or injury. If either partner experiences any pain or discomfort during or after sex, it's important to stop and assess what might be wrong. Sometimes the use of more lubrication or a different position can help prevent discomfort in the future. Number 5. Safe sex practices. Contraception. If preventing pregnancy is a goal, be sure to use an effective method of contraception. Options include birth control pills, IUDs, condoms, implants, and more. Protection from STIs. Condoms, male or female, are the most effective way to reduce the risk of sexually transmitted infections, STIs, during sex. It's also important for sexually active people to get regular STI screenings. Open communication. Continuing to talk openly with your partner about your sexual preferences, boundaries, and any concerns you may have is key to maintaining a healthy and satisfying sexual relationship. Key points to remember. Consent is always required, and it must be mutual and enthusiastic. Communication is essential before, during, and after sex to ensure both partners feel safe and comfortable. Foreplay can enhance the experience, helping both partners become physically and emotionally ready. Protection, like condoms, should be used to prevent both pregnancy and STIs. Aftercare, like cleaning up and emotional bonding, is important for both physical and emotional well-being. Sex is a natural and enjoyable experience when approached with respect, care, and mutual understanding. Everyone's preferences and experiences are different, so it's important to always prioritize communication and consent.